Okay, well, welcome everybody. I am just so happy and delighted that you are all here. Today, we're going to be talking about just what the title says. It says new strategies to defeat and prevent fatty liver disease. So welcome to our masterclass. This masterclass is not just about regulating your liver enzymes, because there are so many people who have normal liver enzymes and they still have fatty liver disease. And then there are some people who have extremely elevated liver enzymes and they do not have fatty liver disease. Is there something you need over here?
Yeah, I'm just trying to get this.
Hold on for a second.
Let's see real quick. Keep going. Go ahead. Sorry.
And they do not have fatty liver disease. Fatty liver disease is often misunderstood, which is why we wanted to come here and explain exactly what it is and how it affects our body. There's so many myths, so many like that are just clouding the facts about fatty liver disease. And one common myth is that only alcoholics develop fatty liver disease, right? That's false. Anyone can develop fatty liver disease, and it's often linked to obesity, diabetes, poor diet. Another misconception that fatty liver is harmless. That's another misconception. That is not true. In truth, fatty liver can lead to serious complications like cirrhosis. And cirrhosis is hardening of the liver. And if that's not taken care of, it can lead to liver cancer. So education is crucial. That's why we're here. We want to educate our people for prevention, for management, and ultimately to defeat fatty liver disease. And that's what we're going to teach you tonight. Understanding these facts can empower you so that you can change and take charge of your liver health. So let's move forward with this masterclass and let's clear up some myths, some things that people are saying out there that are confused about. So if any of you have questions, because we have so much information, we're going to go straight through to the end. If any of you have questions or you would like help from us, we are going to post on the chat our calendar, which is our schedule. So you can go ahead and schedule a free 15 to 30-minute consultation with us to see if there's some way that we can help you. Kim, is it possible for you to post that link if you have it? Now, never stop learning. Here's what you're going to learn tonight. Fatty liver disease leads to a downward spiral of symptoms. For example, low energy leads to a sluggish immune system function because you don't have enough energy to fight those infections to allow your immune system to work correctly. Now that leads to chronic low-grade hidden infections. Right? So people have low energy, then their immune system is compromised. Now they have infections, and that leads to chronic, that leads to toxicity in your body, right? It leads to toxicity in your body, and all those toxins within your body, this is what leads to chronic headaches, to eczema, dry skin, psoriasis, acne, hive, digestive problems. How many people come to us with fatty liver disease and it's associated or related to constipation, bloating, intestinal gas, reflux, irritable bowel syndrome, even an inability to absorb your nutrients. So then that leads people to nutrient deficiencies. So now people have overtoxicity with nutrient deficiencies. They can't absorb their nutrients. So you see, fatty liver disease leads to all of these common signs and symptoms that people are walking around with every day. And once you defeat the root cause, which is what we do for a living, we get to the root. Why do you have fatty liver disease? Once we get to that root, you'll get rid of the common signs and symptoms. So this is an interactive masterclass. I don't want to just be talking and I want to know that you're there and that you're listening. We're going to be asking a series of questions throughout this masterclass. So please respond on the chat. There's no right and there's no wrong. And the reason we do this is because we want to best serve you and we want to know where you are in your health journey. We need to know how much you know so that we can feed you information. For those of you who are seriously seeking help for fatty liver disease, which is under the umbrella of insulin resistance, please, please, please book a call with us so that we can discuss this further. Now, here's what my husband is going to unpack today. He is going to talk about the production of cholesterol. You can go ahead and take a look at this chart. The production of cholesterol, the storage of micronutrients, blood sugar balance, production of bile, protein synthesis, immune system, metabolism, and detoxification. All of this we are going to cover today. So tell me on the chat if this sounds familiar to any of you. Go ahead and tell me on the chat. You feel tired, fatigued, low energy, especially after eating a meal. Brain fog, or you have difficulty concentrating, or even dizziness or lightheadedness. You have to drink caffeine to feel normal because without caffeine, you have no energy. You're tired at night, but you just can't fall asleep. It's that tired but wired feeling, difficulty losing weight, or you're gaining weight around the middle. You know, men and women gain around the middle, and women, we gain around the hips and the thighs. Or maybe you're craving sweets, or you're craving sugar, or you're just craving a lot of food and you don't understand why. What is happening in my body? Or perhaps you have pain somewhere in your body for no apparent reason, meaning that you didn't hurt yourself, but you still have joint pain and muscle cramps and even headaches. How about unexplained hair loss?
That's a big one. Yeah.
That's a big one, not only in men, but in women, or in women, excess facial hair. All of this is related to insulin resistance, which is the big umbrella. And under that umbrella, we find fatty liver disease. Let's see, women can have hormonal problems. Younger women can have irregular menses. They can't get pregnant. Older women, we get hot flashes, dryness, moodiness, low libido. And in men, it could affect their sex drive also, and it reduces their ability to perform. And like I said before in the other slide, that intestinal gas, that bloating, that constipation, and how about allergies to food? Allergies to the environment. Some people are always getting sick and they come to us, or they come to us with skin rashes and eczema and psoriasis and acne, or you just don't feel well. You have weird symptoms that you believe you just have to live with. How about the common things that people have? High blood pressure, high cholesterol, high triglycerides. Do any of these apply to you? Does this sound like you? Because we want to be able to serve you. We only have 4 people on the chat. How about the rest of you? Does any of this resonate with you? Type yes or whatever it is that you want to type. So Aaron, babe, I think you're going to explain this chart here.
Yes. So one of the most important functions that the liver has is bile production. And bile is important for a couple of different things. It's important for fat digestion. And like you mentioned before, many people suffer from not being able to lose weight, or they're gaining weight, no particular apparent reason. And it has to do with that bile that the liver makes. The bile can get stuck. Bile is like this thick substance that the liver makes, and then it puts it into the gallbladder, and the gallbladder concentrates the bile. And as the food comes down the digestive system, the bile is put into the intestines, and that helps. The bile actually wraps around the fat molecules and makes them smaller. Then your enzymes can digest further digest the food. So you need the bile to break down the fat first, and then you need enzymes like lipase to break down the fat further. And the liver is crucial. This bile is crucial for the absorption of vitamin D, E, vitamin A, vitamin K, iron, calcium. We know that your liver also breaks down your hormones, which is very, very important. And I want to mention something too, that's crucial here. Ladies, especially, I want you to be really take note about this. Breast cancer. We're not talking about breast cancer tonight, but it just came to me, and I'm going to give you a little bit of a nutrition nugget. Here's the nugget. Our female hormones are made throughout the day. I'm talking about estrogen and progesterone 7 times a day, 10 times a day. They do their job and they go to the liver to be broken down. If the liver is fatty or stressed, it cannot break down that hormone. It cannot break down the hormone effectively. So that semi-broken down hormone is supposed to go into your intestines and you're supposed to poop it out when you have a bowel movement. But in a lot of women, they don't have enough bile and their liver is fatty, so that doesn't happen. So the estrogen stays in the intestines. And when you have bad bacteria in your intestines, it eats the estrogen and causes different metabolites to form. Those estrogen metabolites get reabsorbed in your body. That's the number one cause of breast cancer, is hormones not being broken down because of a fatty liver. And the bile is not healthy and it's not flowing and the hormones back up. So that's my little nutrition nugget.
Yeah, that's a good nutrition nugget. And to prevent breast cancer, vitamin D.
Yes.
Vitamin D, about 10,000.
10,000 per day is typically, but again, we test them for their blood to see where they are. Yeah.
But you want to make sure that you don't have a vitamin D deficiency.
Right.
Most women that have been diagnosed with breast cancer have a vitamin D deficiency.
Yes. So another important job the liver has is that it stores the blood at night, and the blood from your liver feeds your heart. That's important because the number one killer in this country is heart disease. And what I'm telling you is that having a fatty liver and a malfunctioning liver can lead to dirty blood, which affects the heart in a negative way.
That's good. That's good. So I want to know, put on the chat, do you guys have these signs and symptoms and it's stopping you from enjoying your life? This is when we speak to patients, here's what we hear. We're taking this straight from patients that talk to us. People tell us that they can't be successful because they can't concentrate. They have a brain fog, they can't concentrate, they don't remember what they were going to do next. Or people say to me and to my husband, you know, Dr. Chadwick, these are the other people speaking, not me. They say, I'm going to be stuck with these meds for the rest of my life because my medical doctor said I'm going to be stuck with these medications for the rest of my life. Or you go to your medical doctor and you explain what's happening to you, and they're like, no, it's all in your head. How many of you have heard that? It's all in your head. Or some people say, I miss so many family reunions because they're consistently sick. Constantly sick. Their skin is itching all the time. They can't sleep at night. This is all under the umbrella of insulin resistance. So have a big insulin resistance sign. And under insulin resistance, one of the little branches is fatty liver disease. Problems with your eyes, problems with your skin. It's all related to your liver. Some people tell us, I'm not sure that I'm not sure that I want to be on all these meds, or I'm not sure that I want to get off of the meds because they don't want to die young like their parents died young. Right? How many times do we hear that? Yeah. Or they're not able to do things that they love and enjoy their lives. So, but there is hope in sight, and that's why we're here. We are going to spread hope today. So here's a fact. If you're feeling any of those symptoms that I just described, you are not alone. Yeah, I'm going to give you some statistics now. According to the Center for Disease Control, 90 million people in the United States suffer from fatty liver disease, and they don't even know it. 90 million people, and a large portion of those people don't even drink. Because when we mention fatty liver, they're like, oh, well, I'm not an alcoholic. Well, that has nothing to do with having fatty liver disease. It's just like when we mention insulin resistance, oh, well, I'm not diabetic. It has nothing to do with that, right? Non-alcoholic fatty liver disease has become the most common form of not only adults, but childhood liver disease in the United States. Why? Because parents are feeding their children whatever their children want. And that is bad. And it is causing an epidemic, and it's affecting children. It has more than doubled in the last 20 years.
Yeah.
So welcome everyone, and allow us to introduce ourselves. I'm Dr. Wanda Chadwick, and this is my husband, Dr. Aaron Chadwick. We've been natural doctors, functional medicine doctors. We practice integrative medicine for the last, me 30 years and my husband 35 years. We're certified nutritionists. And we just want you to feel comfortable and know that we have helped tens of thousands of patients throughout our 30-year career. My husband has a biochemistry background, and his specialty is blood work and urine analysis. So much so that not only medical doctors come to him, but he has been dubbed, they gave him a name. They gave him a name, and his name is called the Blood Work King. What do you think about that?
Yes, and we know that there are many doctors who talk bits and pieces about helping you with your health concerns, but we really offer more. We offer very, very comprehensive blood tests, not like the basic blood tests that most doctors run. We give you very specific recommendations and with specific ancient formulas that you can use based on your testing. And you can learn more about this when you join our 90-day program. And we have a book being released coming in 2025. And you can get a personally signed book by pre-ordering your copy now.
Oh, this is our book. This is a copy of our
there it
book
is right there. Yeah.
that it's coming out.
Yeah. So Kim, if you can put the link there in the chat for the book, that would be great.
Yeah. Okay.
But it's been it's a great book about health and nutrition and how you can, have energy for many years to come.
Well, it's talking about the truth of why people get sick.
Yeah.
Why people get sick, the root cause, and how we can reverse that, if possible, without medication drugs that will then add another symptom. And then it's a continuous, you're on medication drugs for the rest of your life. So it is an excellent book. We expect it to go to #1 seller throughout the world. To God be the glory.
Yeah.
Okay, so many of us watch YouTube, right? We watch YouTube. I know I watch TED Talks. I watch a lot of my preachings on YouTube. I sometimes watch videos on health and nutrition. But here's what we've discovered. People that talk about health and nutrition on YouTube are only talking about health in generalities. They don't and cannot talk about specific issues that you are going through. They can't do that because they don't have the details that they need to figure out the root cause as to why you are feeling ill. We need to know what is going on inside your body before we can help you. For example, how do you know which nutrients are missing unless we test you? How do we know which toxins are overcoming your body unless we test you? So that is our specialty, is testing you and putting together a personalized program so that we can start reversing whatever it is you're dealing with from the root. Our motto is, we test, not guess.
Okay, so let's talk a little bit more about the functions of the liver. Maybe you know, maybe you don't know that the liver actually makes cholesterol. And most of the cholesterol in our bodies is made in the liver. It's not from the diet. It's from the liver making it. And there's many reasons behind that. I can do a whole show just on that. But the liver makes cholesterol. Now, I'm going to say another little nugget here. The major reason that people have elevated blood cholesterol, it's because that the cholesterol is made from bile. I mentioned bile before. When the bile from the liver that's made in the liver gets sluggish and it doesn't flow through the liver into the gallbladder, into the intestines, it will back up and that will cause your blood cholesterol to go higher. So cholesterol is made in the liver. Now, cholesterol is a very important nutrient. I can get into all that, but I'm just going to hint tonight, give you a little nugget that the liver makes the cholesterol, and it's important, and the liver decides what type of cholesterol is made. So when a liver is healthy and it's not fatty, it's going to make the right balance of cholesterol. When the liver gets fatty, it can't do that effectively. So you're going to have elevated cholesterol, high LDL cholesterol, high different types of apolipoproteins and all these different things like that. But it suffices to say that it's the liver that makes the cholesterol. And my wife mentioned the vitamin D. The liver activates the vitamin D to its active component. So you need a very important functioning liver to do that. Okay, I mentioned the sex hormones before. I mentioned the estrogens and even in men, testosterone. When your liver is functioning right, your hormones are right. So we can take blood tests and look at the hormones, but we have to look at the functioning of the liver and see if it's fatty. Otherwise, it can cause problems with your hormonal system. Other functions of your liver. Liver makes proteins and enzymes. These proteins and enzymes are crucial for many functions. The liver is in charge of making energy, like my wife was saying before. The liver makes your hair, your skin, and your nails healthy. So if you don't have healthy hair, skin, and nails, you have a liver issue. You probably have a fatty liver. The liver makes clotting factors. What are clotting factors? Well, if you've ever known someone who get a stroke, they have poor clotting factors, and that comes from the liver. We measure in our blood test something called fibrinogen, which is a very important clotting factor, and that can help us to circumvent or to avoid strokes when we understand the clotting factors. But the liver makes the clotting factors, and when the liver gets stressed out, it can't do that effectively. Another sign that there's poor clotting factors, if you have deep vein thrombosis or if you have hemorrhoids, anything with the vascular system, varicose veins, those are related to your liver, right? I mentioned before the cholesterol transport, right? The LDL cholesterol, the VLDL, those are all transporting substances. They carry fat around in your body, and they're all made by your liver. When your liver's not right, you can't do that effectively. Okay, your immune system. Your liver helps to make these immunoglobulins, they're called, and they're activated by your liver. And we need the immunoglobulins to deal with allergies, to deal with skin issues. So the liver is a big part of your immune system. We know that your liver regulates the cell water balance in the body by using a substance called albumin. Albumin balances the water inside and outside of your cells. So when there's not enough albumin, the person will swell up. They'll either have swollen ankles, swollen belly, swollen face, swollen ring fingers. That has to do with the liver being out of balance. So that's a big part of its functions. And my wife mentioned the importance of vitamin D. The liver is important for all of what we call the fat-soluble vitamins. That just means that they absorb in the fat and they're stored in the liver. So vitamin A, vitamin D, vitamin E, and vitamin K. Those are crucial for so many functions in the body, especially the skin, immune system, the muscles need these factors here. Again, I mentioned the clotting factors, artery health. These are just a few functions that the liver is involved in when it comes to being healthy. And when it's not healthy and gets fatty, it can't do these things. We know the liver stores your nutrients. Magnesium, copper, zinc, iron. Magnesium is very important for your blood pressure and for your nervous system. Copper has to do with your blood health, and zinc is for your immune system, and iron, of course, gives you energy. So when the liver stores these nutrients, but when the liver gets stressed out and it has a lot of fat, it can't store these nutrients effectively, so you get signs of deficiencies. In other words, you may have enough of these nutrients in your body, but if you have a fatty liver, they're not going to be used correctly. So you're going to have deficiency signs because the liver is not healthy. Okay. The liver, again, I mentioned before, makes bile. That bile that your liver makes also acts as a detergent in your intestines. So the bile helps your body to break down toxins, kill bad bugs. What are bad bugs? Like bacterias and viruses and parasites, right?
Fungi.
Your liver has to have that bile flowing through it in order for you to kill those bad bugs, right? So that's an important function of the liver. The liver, like my wife mentioned before, Fatty liver disease is under the umbrella of insulin resistance, which is an inability to handle carbohydrates and to handle insulin. And your liver balances your blood sugar. So let's say you haven't eaten for a couple of hours. Your liver takes its stored sugar, we call glycogen, and turns it back into blood sugar. So it keeps your sugar nice and stable. When your liver is healthy and the blood sugar is balanced, you'll maintain that health. And if your liver is fatty, your blood sugar can drop. We call that hypoglycemia. You'll get shaky, you'll get irritable, you'll get brain fog because the liver needs to control that blood sugar, but when it's fatty, it cannot do that. So you get signs of that. How many people suffer with being overweight and have, again, tiredness? The liver activates your thyroid hormone. So you may have normal blood levels of your thyroid hormones, but if you're not activating them through your liver, you're going to have signs and symptoms of sluggish thyroid, weight gain, feeling cold, feeling tired, having your feet crack, especially around the heels of your feet. That shows that your outer 1/3 of your eyebrows will fall out. That's a very big sign of poor functioning thyroid. Or again, it's the thyroid hormones not being activated because the liver is very stressed. Okay. Your liver has a very important process. It's a two-part process of detoxifying your body. We call it phase 1 and phase 2. This detoxification process, we call it conjugation. The word conjugation just means to grab onto. So your liver grabs onto toxins. And I mentioned the estrogens too, but the liver grabs onto toxins from your bloodstream. It breaks them down and it sends those toxins to your intestines to be dumped out of your body through your bowels. We know that in your intestines, if you don't have good liver function and you have fatty liver, the bile doesn't flow. What'll happen is the bad bacteria will grow. One of the signs of bad bacteria is having an ammonia smell to your breath. If you have ammonia on your breath or coming out through your skin, that means your liver is having a really hard time. And the liver, again, it detoxifies drugs and fats and alcohol. Environmental toxins that we're exposed to all have to be processed through your liver. It has been said, estimated that your liver has 500 jobs. 500 jobs. Now, it's quite capable of doing those jobs effectively and efficiently, but when it gets fatty, it has a hard time doing that. And I'm going to say something that's very important. Even though you can have not be an alcoholic and have fatty liver disease, if you drink alcohol, the alcohol is such a poison to your body that the liver will stop its 500 jobs just to break down the alcohol. So
Wow.
I'm sorry to tell you people that alcohol is a toxin to your body, that it makes something called acetaldehyde, which becomes formaldehyde. That's why when you have a hangover, you get a headache because all those toxins are building up in your body. So the liver will stop breaking down toxins when alcohol is there. And
How about a glass of wine?
If you have a fatty liver, I would be off of wine at least for a good 6 months, because you need to get your liver time to regenerate. The good news is the liver can regenerate. And
Right.
You can get rid of the fat out of it, but I would be off the alcohol for about 6 months, honestly.
Right.
Yeah,
That's a lot of stuff. That's a lot that's happening. And people don't even understand or realize that they do have fatty liver disease, but we have been giving you so many signs and symptoms that lead you towards, yes, I may have fatty liver disease. So let's talk about some of the root causes. So there are different root causes of fatty liver disease. Of course, a big part of it is poor food choices, especially eating the standard American diet, which we call the SAD diet, SAD. Eating the SAD diet is going to destroy not only your liver, but everything else in your body.
Yes.
We have this whole series going on with insulin resistance. You're going to have insulin resistance with poor food choices. But there's so much more to fatty liver disease than just poor food choices. For example, medication side effects lead to fatty liver disease, high cholesterol meds, birth control medications, antidepressants, artificial hormones, stress hormones, environmental toxins, chemicals on the food, which is not our fault, but there are chemicals on the food that are damaging our body. So if we already know that there's chemicals in the food, we have to try to make better choices, right? Artificial colorings. And there's so much more. We can't tell you the whole list because we only have an hour with you guys, but there's so much more. Let me give you an example. There's something called glyphosate, right? Glyphosate, what's the other name? Roundup.
Yes.
Roundup is the name for glyphosate, right? And it's a chemical that's used by farmers to spray on the grains such as wheat. Now, it's supposed to make it better, but it makes it worse. Foods like bread and pasta, all those heavy carbohydrates, if they're not organic, they contain glyphosate. And they will change the chemistry of your body. They will damage your organ system. We're not going to sit here and lie to you guys. It is happening, and it's a slow progress, right? A slow process, right? Glyphosate damages your microbiome, the inside of your cell. It goes to a cellular level and starts to wreak havoc there. Your good bacteria in your intestines start to get damaged, which leads to something called leaky gut. And leaky gut, when your gut is leaking, leads to fatty liver disease. Now, there's so many toxins that damage your digestive system, and that's why we like to do testing. In our program, we find out which toxins specifically are attacking your body, and we start removing them from the root. That's what we specialize in. So I have a few questions. Come on, let's play a game. Play along with me, you guys. Let's ask some questions. Just put yes or no on the chat. No right or wrong answer. So what do you ladies and gentlemen think? Is fatty liver disease inherited? Put it on the chat. Let me see. I want to see. Is it inherited? No, it's not. It's not inherited? Well, you're right. Fatty liver disease is not inherited. It's developed over time. Do you want to say anything about that?
So just so you're clear what fatty liver is, I mean, the name tells you what it is, but it's the regular liver cells become fatty. They become engorged with fat. They have fat through them and around them, and that becomes a big problem. The liver is processing things and the fat gets in the way. So it's a big problem.
That's right. Now, next question. Go ahead and type your answer. Do you have, okay, wait, this is a video. I want you to see the video. Okay. Do you have to eat a perfect diet to get rid of fatty liver disease? Because people say, but I eat healthy and I eat perfectly. Well, guess what? As a functional medicine doctor and as a functional integrative nutritionist, I don't really know what you mean by I eat healthy, right? Your eating healthy may not be suitable for your body, and you may still have fatty liver disease. So do you have to eat perfect to get rid of fatty liver disease? What do you think? Let me see the answers. Let me see. Yeah. I think so. Yes. Thank you, Jerry, for being honest. Thank you for that. Let's see. No. Okay. So do you have to eat perfect? No. You do have to make good choices. That's not what I'm saying, that you make crazy choices. Most people are, like I said before, are confused with what healthy really means. The only way that you can know what you need to eat to defeat fatty liver disease and all of the signs and symptoms that I mentioned at the beginning of the presentation that we were talking about tonight is to test your blood. We need to test, you guys, because we can tell you eat this and eat that. I mean, I don't know, you may have an allergy to this or that, because we don't know that unless we look inside your internal terrain. So we don't do just the basic blood work that's offered by most medical professionals. We do a comprehensive functional medicine blood work to know exactly what foods you need to eat. Okay, here's another question. Oh, I can hardly see that question. But let me see. Are there medicines that cure fatty liver disease? Are there medicines that cure fatty liver disease? What do you guys think? Let me see. Can fatty liver disease be cured? Are there medicines that'll just take it away? So go ahead and eat whatever you want, be under whatever stress you want, and just take a pill and get rid of your fatty liver disease. What do you ladies and gentlemen think? No, no, no. Yes. Okay, good. Thank you for responding. Well, I'm going to tell you this, that the regular medical, like we're irregular, right? But the regular medical community says this. It says, no, there is no, oh, wait a minute. I think I messed this up. Oh, I pressed the wrong button. Hold on. Let me do this. I apologize. I pressed the wrong button and got rid of it. So the medical community is saying, no, there's no known cure for fatty liver disease, but there are medications that can help you manage your symptoms and your underlying conditions. So here's what I want you all to think about. Do you want to manage your symptoms and live with them for the rest of your life on medication drugs, or do you want to learn how to defeat fatty liver disease and never have to live with it again? That is a question that you need to ask yourself. Our functional medicine training teaches us that yes, you can get rid of fatty liver disease, but it's not through medication drugs. Right? We have natural medicines, supplements, and other changes according to your specific blood work. So now let's keep going. This is you, babe.
Okay, so this is about cholesterol medications, right? And they do reduce your production of cholesterol, but they don't deal with the reason that you have cholesterol, why cholesterol is elevated in the first place. I mentioned that before. So your body can regulate your cholesterol production much better once you get rid of fatty liver disease. And I have seen that many times again, where my patients, their blood levels of cholesterol normalizes just by defeating the fatty liver. And you can see all these medicines here that a lot of people take. And there is just, those medicines can create problems with your liver. That's the problem. You're blocking the cholesterol. And please be clear, I'm not telling you to stop taking your medicines if you're taking them, but I am suggesting that there are ways of helping you to deal with elevated cholesterol through helping the fatty liver. And that has helped a lot of people to be able to get off their medications when it comes to that stuff. So.
That's right. So all of this fatty liver disease lead to other signs and symptoms and other discomforts within your body.
Yes. That's
One of them is
obesity, right? And we talked about that too, because when the liver gets fatty and you have fat there, the body is not going to be able to burn fat effectively because it has too much of it to begin with. So we have to handle that by the body, handle the fatty liver so it can be more capable of distributing the fat more effectively.
Oh, wait a minute. I'm like messing up this presentation. Right. Hold on for a second. Yeah. We're right here.
Yeah.
Okay. Here we go.
So that's the obesity, and there's a big relationship between that and the fatty liver. And again, once you correct the fatty liver disease, the body's weight can help to be normalized too.
Right. So the next thing that it leads to is inflammation, and you all have heard that word often. Oh, inflammation this, inflammation that. But what exactly is inflammation and how does it relate to the liver?
Well, inflammation is the way the body communicates. When there's a problem in your body, we want to have a little bit of inflammation. But when we have fatty liver disease and we have insulin resistance, we have an excess amount of this inflammation. It's when the immune systems talk to each other. So they're talking too much. And as that happens, as the immune system talks too much, the inflammation increases, we start to see changes in your body. We start to see pain in the joints, anywhere you have an itis like arthritis or gastritis, colitis, pancreatitis. Those are just examples of inflammation. And when one of the biggest things we can look at in your body is a substance called C-reactive protein. C-reactive protein is a marker in your blood that tells us if you have inflammation. And we want our C-reactive protein to be 0.5 or less. So when we have too much C-reactive protein, that tells us there's too much inflammation, which can tell us that there's too much fatty liver. So if you handle the fatty liver, you can handle the inflammation in the body.
That's
and
right.
that inflammation in the body can go anywhere. We know that excess chronic inflammation leads to insulin resistance. Let me say this, like my wife was saying before, you can have insulin resistance and not have any sugar problems. You can, because your body will make more insulin and not use the insulin because of inflammation in your body, because of toxins in your body, because you have a fatty liver. And again, it has nothing, in some cases, nothing to do with your blood sugar, but it has to do with inflammation in your body and having fatty liver disease.
That's good right there.
Yeah.
That's good.
Okay.
So let's go to the next thing that it causes.
Yeah.
I mean, this fatty liver disease can cause so many things. Your brain can become fatty over time.
Yes.
Which leads to dementia, which leads to Alzheimer's disease.
Yes. And we know that, again, like the body depositing fat in the liver, your body will start to look for other places to try to deposit the fat to get it out of the bloodstream. So unfortunately, that can lead to fat in your brain. And when you have a fatty brain, then your brain chemicals can't function correctly. So you can become depressed or anxious, and it'll lead to things like Alzheimer's disease, and it'll lead to things like dementia, and all these things related to a poor functioning brain can actually start out with a fatty liver. So we want to make sure that your fatty liver is under control, which can help a lot with fatty brain disease, right?
Yeah.
So yeah.
There's so many things that can happen within the body. So many things. And we're not here to put fear in you. We're here to bring hope.
Yeah.
That's what our purpose is. You know, our tried and proven programs that we've been doing, for me, 30 years, my husband, 35 years, we have helped tens of thousands of people defeat any sort of disease that they have from the root cause. Now, we have a program. It's called the Defeat Fatty Liver Disease Program, and it's a 6-month program. There aren't drugs that will defeat your fatty liver. Your medical doctor will only help you to manage it, and you will be on those medication drugs for the rest of your life, which will then damage you at a cellular level and cause it's kind of a snowball effect, cause other problems. We have helped all sorts of health concerns, including fatty liver disease and all of its signs and symptoms.
Yeah, I just wanted to say too that remember that fatty liver doesn't develop overnight. It takes years and years and years. And a lot of times unknowingly, it's developing inside your body because of these different things we're talking about tonight. So it takes some time to get rid of it. So our 6-month program is a really good way of helping your body to defeat that. We find that you can do a really good job in 6 months of getting rid of fatty liver.
Yeah, I apologize for that. I just messed up all these slides, but I do want to show you some testimonies. I want to read some testimonies of some of our patients that we have helped. The last time we did this, we had some patients here talking about what we've done for them. So I'm going to lean into my computer so that I can read this. It says, Dr. Chadwick and Dr. Wanda, what can I tell you about this couple? I didn't believe that they can help me at first. I remember Anita. She didn't believe in natural medicine at all. She didn't believe in any of the supplements that we were going to put her on. She didn't believe in stopping her alcoholic intake. She didn't believe in any of that, right? Dr. Wanda persisted. I could be pretty persistent that she talked with my husband, Dr. Chadwick. She gave in and she did speak with Dr. Chadwick, and she says, best decision ever, right? I'm writing this testimony to help others. They saved my life. I was diagnosed with fatty liver disease, and I was told that I needed a transplant. But with their guidance, I reversed my condition in just about it took about 6 to 7 months. Their personalized approach helped me understand my body's needs. She lost 30 pounds. My energy is soaring. My liver enzymes have normalized. I couldn't believe it, but now I'm a believer. Now she's a believer in natural medicine and what we do. I'm living proof that fatty liver disease can be defeated. That's a 44-year-old woman. Now let me show you a testimony from a man who's just slightly older, 65, still very young. We play pickleball with 90-year-olds. So 65 is nothing right now, right? So here's what he said, Warren. He said, I felt hopeless. When we first met Warren, he felt hopeless. He didn't think that he thought this was the end for him. Like, that's it. I don't know what else to do. I was stuck in a cycle of fatigue, pain, medications. I thought that was it for me for the rest of my life, that I'll be on medication drugs or on prescription drugs. Dr. Chadwick and Dr. Wanda gave me hope. I didn't have another choice. Either this worked or that's it. Dr. Chadwick's expertise and bedside manners are impeccable. He is compassionate and gave me hope when no one was giving me hope. Dr. Wanda is an encourager. She empowered me to take control of my own health and to stop complaining about it and to do something about it. They transformed my diet, put me on a 6-month program, and that started to reduce the inflammation. He was full of inflammation. Everything hurt him. Couldn't walk. We're like, come play pickleball. Well, can't play pickleball because he's in pain. He regained his male vitality. My liver function improved by 80%. I'm grateful for their unwavering support and life-changing guidance. That's Warren. And then let me see who's next. Oh, this is even a younger woman. I was on the brink of liver failure, and Dr. Chadwick gave me a second chance. I remember she kept saying, I'm too young for this. I'm just too young for this. Well, guess what? Children are being diagnosed with fatty liver disease today. And it's grown by 20%. Yes, in the last few years, children, because of the food, because of the habits. This world has bad habits. Their comprehensive approach addressed my nutritional deficiencies, toxicities, my poor gut health, and emotional well-being. I was eating poorly, abusing my body, and all this affected my mental health. I lost 40 pounds. My liver enzymes went down. I'm completely off of medications. I was scared of those meds. My medical doctors had me on. I got my confidence back. I'm not always tired anymore, and I'm pursuing my career again. I felt like I'm living again. Dr. Wanda did not let me fail. She prayed with me and gave me words that lifted me up. Thank you, Dr. Chadwick and Dr. Wanda, for helping me live life to the fullest and I'm myself again. So these are just some of our patients. We have tens of thousands of patients that we've helped. Now, I want to know, with everything that we've taught you tonight, did you learn some things that you did not know before? Go ahead and type it on the chat. What did you all learn tonight? Because if I had not studied this, if this is not what I do for a living, I wouldn't know all this. That fatty liver disease can lead to so many signs and symptoms, or so many signs and symptoms can ruin our liver. What did you ladies and gentlemen learn tonight? Nothing? No, nobody learned anything tonight? What did you ladies and gentlemen learn tonight? Well, if nobody learned anything, you're very, very smart, because unless I did this for a living, I wouldn't know that the liver does 500 jobs. Yeah, that's right, Kim. The liver does 500 jobs. I didn't know there were so many symptoms of fatty liver. Right, Isa? That's good. Vitamin D is a crucial nutrient. Yes. And especially, did you all learn that most women that get breast cancer are deficient in vitamin D? Come on, if we knew that, us women, because even men get breast cancer, if we knew that, we would be running to the health food store to get vitamin D, right? But it's not common knowledge. We have a very, very effective way of getting rid of fatty liver disease and all of those horrible signs and symptoms. So we're here to tell you that there is a better option. We will lock arms with you and work together with you, where we have our vested interest is in your success. We have an offer. So here is what we're offering tonight to all of you. We have a tried and proven system that can defeat your fatty liver in the shortest time possible. We have an exclusive, personalized program to get rid of all of those nagging signs and symptoms. We get to the root of why you have fatty liver disease. We tailor a program specifically for you according to your blood work. And here's what you can expect. Here's what not within 6 months, 6 months and beyond, here's what our patients have experienced. I'm just taking this from what he tells me about all of the patients. Let's just get some of them, read some of them. Oh, so it's cut off. So it's reduced inflammation. That's important. Better sleep, reduced risk of chronic disease, lower risk of developing type 2 diabetes, lower risk of developing cardiovascular disease, which is the #1 killer today, lower risk of developing certain cancers, reduce risk of hypertension, cholesterol, detoxification. I mean, these are all of the things that happen when you defeat fatty liver disease. Enhanced mental clarity, like our patient said, improved skin health, improved eye vision, improved eye health, enhanced immune function. Let's see, what else? Hormonal balance. So here are some of the blood. Wow, it really cut out. It says comprehensive blood work, you guys. That's what it says. Our 6-month program includes our comprehensive functional medicine blood work. And in these 6 months, you will get 3 comprehensive functional medicine blood work. 3 of them. Wait, hold on. Yeah. Oh, that's even worse right there. Let me see. I can't do it now. So let me just believe me what I'm telling you. So we get 3 blood work. So I just want to let you know for your information that the blood work that we do, most medical doctors charge $3,000 and above. And you get 3 of them included in our program, one in the beginning, in the middle, and at the end. We have a team of health professionals that will be working alongside with Dr. Chadwick and myself. One of our health coaches is on the line tonight. Her name is Kim Dugan. And Kim, are you there?
I'm here. Hi, everyone.
Can you go ahead and introduce yourself and tell people what you do? Kim?
He's frozen.
Kim, are you frozen? Well, Kim is our health coach, and she has been vetted by us extensively. She is excellent at what she does, and our program includes the blood work, and it includes this is all digital and virtual. It includes visits with Dr. Chadwick, with myself, and then Kim will do all of the follow-up with the foods that you need to eat, what your blood work says, what you need to do, all of your lifestyle changes. Kim, are you back?
I'm here. Do you hear me?
Yes, yes.
Okay, perfect. Hello, everyone. My name is Kim Dugan. For me, it's an honor to be part of this wellness group. I'm the health coach, as the doctor said, for this group. As Dr. Chadwick said and mentioned, I'll be here to work with you alongside the doctors, guiding you, answering all your questions. You can call me, text me. We'll be talking about nutrition, supplements. You won't be alone in this process, right? So I'm part of the group, so I'm your health coach. I think I've talked to a few of you that I called you
Yes, she's having internet problems today.
Yeah.
She's in Western Florida and she's having a lot of internet problems. But yes, she's the one that you can call, that you can text. If there's a pressing issue, she will get together with us, the doctors, and we will fix this. This is kind of like a concierge program. But here's the deal. We have so many people that want to join our concierge program that our space is limited. We're only taking 20 people because this is a personalized program where we take care of you to the highest level possible. We work on your insulin resistance. We work on your fatty liver and anything else that your blood work indicates. So I'm going to suggest that if you want to talk to us, that if you want more information, if what we taught you tonight makes sense to you, and you want to experience relief from the signs and symptoms for fatty liver, we have a solution. You can book a call. If you're serious about your health, please go ahead and book a call with us. Here's our phone number. And then if you have your camera, go ahead and take a picture of how to get into our calendar. That link in the bottom is how to get to our calendar. And I believe that Kim has posted that. Oh, yes. Join us for, book your consultation. Yeah, so the call is the best way to find out if you're a good fit for the program. Because we don't want to take people if you don't need this program. We only want the people that need this program so we can start defeating and reversing everything from the root cause. Listen, ladies and gentlemen, there are no strings attached and there is no commitment you'll need to make during that call. But I do need people that are serious about the health, that want to make a change and want to live a long, prosperous, healthy life, just like the good Lord ordained it.
Yes.
So I think that's it. That is it. We are at the end. Like I said before, we only have space for 20 people. Every few months, we only could take 20 people because we really cater to our people and give them our all. So that is our program for tonight. I pray that you learned a lot, that you got a lot from it, that you took down the phone number, and that you book a call. So thank you for being here, everyone. God bless you all. Don't forget, for questions, give us a call, book a call. Until next month, we do this every month. Actually, next month is near Christmas. So this is the last one for the year. So we will see you all in January. Have a great, happy Thanksgiving. God bless you all for Christmas. Merry Christmas. It's all about Jesus. And we'll see you then in January 2025. Good night, everyone.
God bless you all.